Super. So first of all, thank you all very much for coming to this session today. I really hope that it's going to be a worthwhile session where we can really debate some of the issues that we've been talking about for some time. And I guess I just wanted to start by reiterating something that Martin talked about, because he talked about personal experience. And I think through the course of today, we'll probably get into talking about some really quite technical stuff. We might start to talk about digital maturity indexes, infrastructure, PSN, information governance and toolkits. And that's all really important. But I think I wanted to just start with a reflection that says this ultimately is all about people. It's all about improving people's outcomes, improving services, empowering individuals. And it's easy to kind of, I think, get lost a little bit when you start to talk about some of the challenges, and also some of the language we use. So I just wanted to get that out right away and say this is what our ultimate ambition is to do. It's my job to provide a bit of context to start the day, and so I thought I'd just start with some facts and figures. These are probably all very well known to you, but I think it's always worth reflecting on them again. So over the next 20 years, we've got the proportion of the population aged 85 set to double. We currently have people with long-term conditions accounting for 70% of all health and care spending. Over the next 30 years, the number of people living with dementia is set to double. We know that there's significant pressures on funding. So the NHS is predicting a funding gap of 30 billion by 2021, and the LGA, similarly for social care, a £16.5 billion gap. And all of this is leading to increased pressure on services. So a couple of facts that I've pulled out here, that over the 5 years to 2013, the number of over 80s attending A&E rose by 65%. And the NAO has suggested that 20% of emergency admissions are for existing conditions that could be treated in community and social care settings. So we know there's a big challenge. We also know there's an awful lot of people involved. So today we're sort of talking about social care. So in terms of the people that social care is supporting, we've got about 400,000 people in residential care, and 56% of those are state supported. We've got about 1.1 million people in home care, and about 80% of those are state supported. We don't also want to forget the workforce. We've got 1.5 million people employed in the care workforce, and I believe that's the fourth biggest employer in the country. And we've also got about 6 million informal carers. So within this context, there's an awful lot of people working in social care related roles. And looking to the future, so we sort of talked about the demographic change, but we know from evidence that we've been doing modelling within the department that about 3/4 of people aged over 65 will need care and support in later life. We also know that those 3/4 of people will also use lots of other services as well. So older people, heavy use of acute services. So 60% of admissions, 65% of bed days, and 70% of emergency readmissions are all from the over 65s. In terms of social care spending, we also know that 72% of older people, and that accounts for about 56% of overall social care expenditure. So I just wanted to put those out because I think it just helps in terms of thinking through why this agenda is so important. And we're doing a lot, and you'll be aware of this, I'm sure, within your own local authorities, to try and tackle these challenges. So we've got the Care Act, we've got the integration work with the Better Care Fund and the Pioneers. We've got the whole movement towards personalisation, which has been working for a number of years now. We've got quality, seeking continuous improvement in care, and we've got prevention and the increased use of promotion of self-care. So all of this is sort of going on, and at the same time we also know that you're delivering a whole range of other priorities within local government, such as working with children, troubled families, etc. So there's an awful lot going on, there's some big challenges, and I guess the purpose of being here today is to think through how can technology and data really start to help us tackle those in the future. So our view is that sort of investment in data and technology is a real way to help think differently about how we deliver services and improve outcomes. So I was recently at a National Information Board, and for those of you who don't know, the National Information Board is where the Department of Health gets together with all of its arm's length bodies, and we basically are trying to have a coordinated approach to the way in which we deliver care and health and social care. But it brings together the CQC, NHS England, the Health and Social Care Information Centre, Monitor, the regulatory authorities. So there's a lot of people around that room, and Tim Kelsey chairs that board. And Tim gave quite an emotive speech at the last meeting about how technology was not an enabler. And I realised, as you were saying this, that I had on my slide, technology was an enabler for making all of this change. And it made me stop and think, actually, that is wrong. Because what his argument is that we shouldn't be thinking about what do we want to do and then think about, well, how could technology and data help us? We should be sort of spinning that round and saying that actually technology and data and information and systems can actually be a way of designing those services from the start. So I guess what you're saying is you can actually make care safer if you design it with from a technology point of view and using data. He was very much thinking about something like in hospitals, e-prescribing. So if we think about moving to digital prescriptions, the chance of making mistakes reduce quite considerably. So he was saying this is no longer an enabler, this is no longer we go off and do that and then we think how does the IT system change to support it. Instead we think about what can technology do to transform it. So I pulled out a few bullets there, but from my perspective, I think this is all about thinking through, in the future, how we can use this agenda to put citizens and communities at very much the heart of the system, delivering services that really match their needs, but also support self-care. It's all about how we can share information more easily across multidisciplinary teams and with citizens themselves to improve the quality and experience of care. It's all about how we use data differently and package it together and link data together so that we can better understand pathways of care and understand how best to kind of change our investment across the whole of the health and care ecosystem to really drive change. It's looking at how we can continue to improve through transparency and sector-led improvement and using data to drive sector-led improvement. And it's all about thinking about how we can deliver services differently. So a good example that I think was on the Today programme a few weeks ago was about, I think it's Airedale or Calderdale, one of the two, who are doing Skyping with care homes from A&E. Airedale, thank you. So that was a good example of how you're thinking of changing the way services operate. But we know this is going to be quite difficult, so I realised I've done my pitch, and we're probably all sitting there going, yeah, that sounds great, but look at all these challenges that there are. I think we know that, we recognise it. I'm not going to go into them all now, but we know there's issues around network, the PSN-N3 debate, information governance and security, very tricky issues that a lot of work's going on to try and support improved information sharing, but we know it's hard. And the availability of data, where we get it from, the data we hold, how we use that data, how we link that data. So there's, it's not easy, but we know those challenges are there, and the question now is how do we work together, both nationally and locally, to meet those challenges. So the roadmap for change that we've set out, to do that, the first thing that we're focusing on with the department is how we deliver on a whole set of the core social care programmes. So the Care Act is a big one, obviously. Integration is another one. The second area that we're looking at is how we can then, part of the first one, is how we influence the national policy. So how do we look at influencing what's going on, for example, on NHS mail, so that we can look at delivering a solution that could work for the whole system. So that's sort of social care and local government influencing, if you like, the traditional health spend. And health spends an awful lot. I think it's about £1 billion a year we spend nationally from the Department of Health via NHS England and NHS on health infrastructure and systems. So the second big area is all about how we work in partnership with you and local agencies to really work through what needs to happen nationally and what can happen locally. So we've been working really closely with Socitm, with ADAS-IMG, with the local CIO council, with the pioneer sites, to really start to sort of see, in a sense, from a locality perspective, what is it that you want to achieve? What is it that can help? What that you can just get on with and do? but what is it? What are the things that actually are the national barriers and blockages that are stopping people achieving what they need to do? And there's a whole set of things where we're trying to support other initiatives around things like market development, but we don't have necessarily some of those direct levers. This slide is quite complicated, but I'll just go through it quite quickly. It basically sort of provides a sort of overview of the work programme that we're looking at nationally. So the first bit in sort of blue is around those core priority programmes, so the Care Act implementation, integration, information governance and transparency and comparative data. And then sort of going over to the right is some of the underpinning work that we need to do to start looking at that. And Andrew's going to talk to you later about some of the work that he's leading around standards to support interoperability. We're also working with the Technology Fund, the Integration Digital Care Records, where some of the successful bids will hopefully be announced shortly, and the infrastructure and systems. The bit underneath is, I guess, how we look more to the future. What is develop really the economic case for further investment in social care informatics. As you all know, we've got a spending review coming up. We're going to be looking at ways in which we can deliver services more efficiently. So actually evidence that can demonstrate what impact initiatives around technology have on social care services, and also rewarding with health is really important. So I think one of the things we're really keen to do is to gather that evidence so we can start to build that case for investment.